Minister, I have a number of questions. The first question is in relation to nursing homes and what has happened in the past 6 months. And there's 5 separate inquiries at the moment in regards to what happened in nursing homes. And it really reads for extremely grim reading in what has happened in nursing homes. 971 deaths, 56 of all deaths were associated with nursing home clusters. Of 5,608 confirmed cases of COVID-19 in nursing homes, only 422 were hospitalised. So it really reads for really grim reading. Minister, will you commit to a public inquiry into essentially the catastrophe that has happened to the nursing homes, because it's owed to not only the people that have died in the nursing homes, but also their relatives?
Thank you, Deputy Kenny. Deputy, we may well end up at an inquiry, a public inquiry into what happened in nursing homes, and I know you and many other deputies have been advocating very strongly. The loss of life is heartbreaking, and relatives are very understandably asking, was all that could be done done? We have to look at that now, not with the benefit of hindsight, but with the benefit of understanding that what was done happened in a crisis the likes of which hadn't been seen before. I'm aware, as you are, of some very serious incidences in individual nursing homes, both in terms of individual residents and indeed of very high mortality levels in particular homes. And as you say, the various agencies of the state have been looking very closely at this. HICWA produced a report, which I'm sure you've seen, which looked at the half of the nursing homes that didn't have COVID outbreaks and how prepared they were. I responded to HICWA and asked them to do the same report for the other 50%. Most importantly, I think we got the nursing home expert group report with 86 recommendations. So, Deputy, can I say, and maybe you agree, I hope you agree, that the priority, the number one priority for us all right now is making sure that everything that can be done to protect nursing homes, to protect the residents, to protect the staff, is done. And the focus right now is on what have we learnt, what has worked well here, what has not worked well here, what has worked well in other countries. Are we doing everything we can to protect people most vulnerable to this awful virus? At the same time, to your question, it is absolutely proper and essential that the families of the residents who have passed away or indeed become very sick get full transparency as to what happened. I don't believe that right now is the time to start a public inquiry because we're focusing on keeping people safe. However, I am most definitely open to the idea. I want to see what happens over the next while, work with Nursing Homes Ireland, work with the expert group, work with the implementation committee, focus on keeping people safe and saving lives, and then see what the most appropriate way for families to get answers to their very reasonable and pressing questions is.
Okay, Minister, but will you commit to a public inquiry in your tenure as Minister of Health? Because all the evidence points that we need a public inquiry in relation to what's had to happen in nursing homes. So all the evidence says that we need a public inquiry for each one of them deaths on what reason that there was such a catastrophe. Because behind all them stats where I've said is, a grandmother, a granddad, father, mother, and it reads for really grim reading, and it warrants a public inquiry at this moment of time.
Thank you, Deputy, and I absolutely share your concern and heartbreak about what happened. What I will commit to, Deputy, is that the right approach is taken to answering the questions that need to be answered for the families. So, in cervical check, for example, the right answer was deemed not to be a public inquiry, but by the most excellent work that Dr. Scally did. That led to an awful lot of recommendations which are being implemented, and indeed to the setting up of the tribunal which is happening in the next few weeks. So can I say to you, it's a discussion for the Oireachtas, it's a discussion for government to see what the most appropriate mechanism is. In the other, well, there are many very sensitive ones, but one that you and I were very involved in cervical check, I think we would all agree that the work that Gabriel Scally did was the right approach in that instance. So we need to consider what the best approach is for the families of the people who have passed away, to make sure, first of all, that their voices are heard. Secondly, that they get the answers and they get transparency. And thirdly, that it is done in a timely way that does not kick on for years and years.
Minister, just one final question. Your former Health Minister last March said there was no room for private healthcare in the pandemic. But just, I was contacted by a person yesterday, and in order for them to get a COVID test, it would take 24 hours for an appointment and 48 hours for a result in the public health service. So that's 3.5 days, I think. But if they pay €250 to the Beacon Clinic, they would get that result in 12 hours. Now, how does that kind of match up when we've just spent €350 million to private healthcare in relation to the pandemic?
Thanks, Deputy. The median time in the public system from a swab to a lab result is 30 hours. It's 1.2 days. The additional time, I don't have the details obviously, but I'm more than happy to look at them. But when people talk about median times of approximately 3 days, it includes several days of contact tracing that happens afterwards. But the median time at the moment for the HSE from a swab to a test result is 30 hours.